Hi there, everyone. Welcome to my first Facebook Live of 2023. Tonight's Facebook Live, I am taking you into the operating theatre. So if you don't like gore, maybe switch off now. If you love gore or you're not quite sure, I will give you plenty of warnings when stuff is coming up. But this is really a great opportunity to have a look at what goes on in an operating theatre. Hopefully explain a lot of the mystery around surgery and maybe explain for those of you who are going through recovery some of the things you might be feeling, and for those of you who've been through it, what you did experience, and for those of you who've got surgery coming up, hopefully dispel some fears or nerves that you may have. So let's say hi to, we've got a lot of people already, we've got 27 people on, so clearly our patients don't mind a bit of gore. So Lorraine's out there, Jane, Eliza, Katie, Kerry, Bindi, Leanne, Jess, Lily, Meg, Karen, and Sarah. So thanks everyone for joining. I'm trying a few new things tonight, so bear with me. I may have a couple of glitches. We'll get to all of your questions after I've gone through the video, and also give you a heads up on what is coming up at RE for the month of January. So tonight's video is all about taking you into the operating room of a plastic surgeon. I'm going to highlight two main operations. Firstly, an abdominoplasty or tummy tuck, and then secondly, a breast reduction. So I'm not sure, obviously people have done this live. This is probably going to be a little bit more detailed. So thanks very much to the patients who very generously allowed me to use their videos. We have tried to cover up as much as we can, which we have to do for Facebook and YouTube. Anyway, I am streaming on YouTube, so if anyone is actually on YouTube, please give us a shout out. All right, let's get into it. All right, so this is me marking up an abdominoplasty patient. So what you can see there, I've started with the patient lying down, and I've marked, now this is the new thing, I've marked this line here. Obviously that's moving, but I mark that so it's at the top of the pubic bone. From there, I then extend that line out, which you can see, whoop, it just moved. You can see, actually I might, well, let's just see there. So you can see there, so the skin between those two lines is the skin that I'll be removing. Now, let me see, I might be able to, no, I can't. But you can see I've made that horizontal line, I've extended it out laterally, I've then marked the midline, and then marked that upper excision of what I'm expecting I can remove. And you can see with the patient here, I'm trying to make sure that they're both symmetric. And you can see that red line, that's the laser leveler that I usually use. And I'm pinching there just to show that I think that's the amount of skin that I'm going to remove. So For those of you who've been through a tummy tuck or a lower body lift, you have seen that, and I'm just demonstrating there that loose skin. Okay, so if you do have any questions, just pop a Q in front of the question, and I'll search for that, and we'll get to them at the end. So then the patient goes into the operating theatre, off to sleep. I didn't video any of that, couldn't show you everything. But once the patient's asleep, we then do, so this is a little bit graphic, warning, we put in some local anaesthetic. So if you're looking at that screen there, that's towards the feet where I'm injecting there, so the lower part. So that's got local anaesthetic, which is long lasting, lasts about 12 to 24 hours. And it's also got adrenaline in it. And I also use another drug that helps to decrease the amount of bleeding. So if you have a look there, I have filled up all along, hopefully this will work, I've filled up all along that incision line, all along that incision line, and then I usually put in into the actual skin that I'm removing as well, and that's mainly for the adrenaline, so we don't get too much swelling, too much bleeding, or too much bruising. I just had a look, and I'm not sure if my audio is brilliantly synced. Does my audio look not synced to everyone out there? If anyone can just make a little comment. Otherwise, I'm going to get on to the next stage. Now, this stage doesn't apply for everyone, but for this patient it didn't. It's working fine. Great, all good. Now, sometimes there is a bit of liposuction. This is actually a different patient. Again, a little bit of a warning, but here we go. So you can see here, another tummy tuck patient, very similar, but I've put some local anaesthetic in the flank area there. I've made a little stab incision, and then this is the liposuction machine. Obviously, we've sped that up a little bit, but I'm just shaping, and you have a look, I'm just feeling with my left hand always where the end of that cannula is. And a lot of stories in the news about, you can see that shaping area there. Been a lot of stories in the news about non-surgeons doing liposuction getting into all sorts of trouble. You can see there, a very important part is with my left hand feeling where that cannula is. So, so you can see how, hopefully you can just tell there that that has just shaped that waist a little bit. Not everyone needs it, of course, but when you do, then that's when we do it. All right. The next part, again, a little bit of warning, but this is what some of the people, some patients' favourite part is where how I start making the belly button. Somewhat of a favourite for most people. Here it is, a little bit of a warning. I'm going to put the warning on everyone, so you can look away if you want. But here I am at the start of the operation, and I'm just cutting around your old belly button. So everyone sort of wonders if you keep your belly button, for those of you who haven't had surgery. But you can see there, I have just cut around that belly button, and actually that was a little zoom in. And I put a little stitch in just so that I can control the belly button. That's just a temporary stitch. And you can see me lifting it up there, lifting up the belly button so that I've got total control, and I've gone all the way. I'll try and draw on that here. I've gone all the way around it like that. Hopefully that'll come up. I'm having a few problems with my pen, but you can hopefully see that I've gone all around that belly button, and it's totally free from the surrounding skin. Lily, I'll get to your question, but just a reminder, put a Q in front of your questions because it'll make it easier for me to find them at the end. All right, now, this one is super graphic, so a bit of this, maybe, see how you go. Most of you, I think, are okay with this, and it is sped up, but don't say you weren't warned. And another little warning as well. Okay, so I start with that lower incision. You can see just drawing along my line. That's why the lines are really, really important. So I've made that incision, and now I'm going just a little bit deeper. Surprisingly, very little blood. This is cautery, so this is, you can see sort of the heat that's generating. And so that enables me to cut through that deeper layer of tissue, which is fat, and some supporting tissues with very little bleeding. And you'll see I've got a little white cloth there. They're called packs. And here I'm just clipping a little vessel. It always generates a lot of excitement because people sort of wonder what. See if I can go backwards a little bit on this. So those little metal clips don't cause any problems. Every single surgeon uses them in every single operation. They used to clip little vessels. But I think the important thing, or the interesting thing there, is that there's very, very little bleeding, much less bleeding than what you might think. So, all right, so we've got through the incision. The next thing is to lift the skin up off the muscle. Now, I did a quick poll around the office today, and everyone said leave this out, and I said no. I think everyone will be okay. Everyone loves this. They're going to want to see it. We've got 49 people watching, which is probably one of our highest watch rates ever. So I'm going to give just everyone 10 seconds to look away or do whatever, or put a big message there saying don't show it, don't show it, and then we're going to launch into it. So this is actually me taking totally show. Of course, Jess, of course. Okay, so warning, warning, warning. So this is me now lifting that skin up off the muscle wall. Again, I'm using the cautery, and you can see virtually no bleeding. So that's lifting that up off that muscle wall, which you can see, that white tissue is the layer over the top of the muscle wall. And I'm just lifting that all the way up to right up to the rib margin, actually. So that goes all the way up. Obviously, I put this on a replay so you can see that again. And just very, very surprisingly, for such a big operation, very, very little bleeding. Okay, so we had quite a bit of support for that. Okay, I actually thought that was the most gory. It's maybe not the most gory. This is definitely, no, we've got a couple more that are more gory. Anyway, everyone seems to be coping all right, but don't say you weren't warned. So after I've lifted that skin all the way up to that, basically up to your ribs, I then need to, I then divide the flap. Some of you who've had your photos, asked for photos, which I've done, you'll see there's always sort of two triangles of skin. So this is where I split them. Okay, super gory, super gory. All right, so I've lifted that all the way up. You can see all that skin's been lifted. And then I'm going to split that all the way down from the belly button down to the bottom. You can see my assistant just holding it up there. I go all the way up to the belly button, and then I can do a little test closure. So, all right, everyone is still watching, and no one, I don't think anyone has hopefully no one's passed out. You have to let me know if you like this in the comments below, because if you like it, there's plenty more operating that I can show you. So, all right, I think this is maybe the most gory. So I've lifted the skin up. I've lifted all the way up to the rib margin. I've tested, made sure I'm not going too much with the skin. And now I'm going to cut the skin off. Okay, so let's go. Big warning, big warning. All right, so this is me. So I've cut that skin off, and that is the skin. The yellow is the fat. The skin is obviously the skin, and there you can see that. You can see that those two triangles of skin. In the middle, obviously that's the maximum amount, and then it tapers out to the side. So hopefully that was okay. From here on in, it's not so bad, not so bad. All right, the next is the muscle repair. All right, we've got to do a little warning on all of them. All right, so you can see there, I'd love to be able to pause. I don't know why I can't pause. So you can see here with a marker. Now, for some of you watching, there's not much marker and it's blue, okay? So special shout out, you know who I'm talking to. So I've marked that there. I'd love to play that again. Here we go. So I've marked, you can see right in the middle, it's very, very white. So that's the gap, okay? Or here it's yellow. And so I'm just going on the outside of that, and that's where I'm going to do my muscle repair. You can see it goes all the way up, right up to the top of the rib margin. I actually haven't finished yet. In the next video, you'll see that. And then that's what I'm going to repair. So the next thing is then, of course, the muscle repair. So warning. So this is a permanent suture. It's a barb suture, which is like fish hooks. So I don't need to put knots in. And you can see me going all the way up. My assistant lifting that up. That's their least favorite parts. It sort of takes quite a bit of force. And I'm stitching all the way from the top down to the belly button. And then I go actually back up again. So it's a double layer of repairing. You can see the difference there in that upper part. You can see I'm just slowing that down where I'm finishing it off. In real life, it takes about 15-20 minutes. And now it's repaired at the top, so you can see those two blue lines have come together. And then I'm going to do the same down the bottom. So for those of you who've had a tummy tuck and say, oh, it's a little bit sore, this is why. You can see how those lines have come together. So we've squeezed them together, and you'll be able to see at the end. I think I'll do a little test. I haven't put the sound on for this. But you're going to see just, hopefully you can appreciate how much tighter that all is. Here we go. It's like a brick wall now. So before we do it, and if you've had a consultation with me, you'll know the tummy wall is often very, very floppy. There's a gap, the divarication, the separation of the muscle. But that's sort of one component of it. The main issue is really that the muscle wall is just very, very loose. Alrighty, so after that, again, we actually put a little bit of local anesthetic. So you can see that muscle repair, see the belly button sticking out in the middle there, hopefully. So that's the belly button there. Oh, moving. And I'm just putting some local anesthetic at the edge of the muscle, which should give a little bit of relief. This is the belly button here, and you can see the repair. I'll change that into a blue color so it's all matching. All right, so you can see that repair now. It goes all the way down there. And you can see here, okay, you'll see this in the post-op. See that line there? So that's the junction where the central muscle comes into, or the oblique muscles come into the rectus muscle. And just remember those two blue lines on the side there and that curve, because you're going to see that in real life in a second. All right, so I've done the muscle repair. I've cut off the skin. We now need to, we do a temporary closure. And this is really interesting because you'll see the bed getting broken. So this is how much skin I cut out. So I put a stitch in the top, stitch in the bottom. And you see when the patient is flat, I can't even nearly get that closed. And now we ask the anaesthetist to break the bed, and you'll just see now the bed just start to fold in the middle. Now I can't possibly get it closed. You can see the head coming up a little bit, and now I can close it. Now, not all surgeons actually do that, and so they can't get out as much skin, but you can just see by bending the bed in the way that you saw there, we can get out a lot more skin than if you're lying flat. And that's the reason why. So this should be very helpful for everyone, whether you've had surgery or whether you're coming up to surgery, why you walk around stooped for the first couple of weeks. And it's because I've had to bend the bed to be able to get that sort of closure. All right, everyone's favorite part. Anyone take any guesses? So I've pulled the skin down just temporarily. We're still missing something. Anyone want to take a guess? All right, if there's no guesses, I'll jump straight into it. We're going to pull the belly button out. All right, so here it comes. So I've got to make a little opening. I've got to make a new opening. There we go. Don't want to reveal all my secrets, but it's something like that. And then I make a little cut in there. There are a few other little technical things that I do that we don't really have time for. But I'm making a little split in the skin there. And then you'll remember I had the belly button on a little stalk. And so I then pull that up and then we stitch it into place with a few little modifications. So yeah, a few people guessed it. Terrific. Alrighty, we're nearly there. I then have to put some drains in. You'll all be able to do one of these. I'll be out of business. All right, so they come on a little spike. I push it through the skin, boom, out it comes, and then we just stitch it in. But have a look here. I just wanted to show this because I want you to see where it's actually lying. So it actually, this will help actually. So I'll have one line here, which comes out that way, and then one there, which comes out that way. All right, so I always have two. The right one, I always do that it's going to the upper part, and that's usually the one that comes out first. And the lower one is coming out on the left side, lower left, easy to remember. That I usually, if one drain stays in, that's the one, because when you think about it, when you're standing up, any fluid that's collecting is all going to come down to the bottom one. So sometimes it can be a bit confusing because sometimes the top one, when you're lying flat, has drained more, and I say, yeah, take that one out, because I know once you get up walking, the bottom one is going to take all of it down. The upper one is mainly in just to help that skin. You can see the big space, the two raw surfaces. So that upper one is mainly in at the start to help them stick down because it's on negative suction. Alrighty, we're nearly done with this one. I then put in get rid of that. I put in a deep stitch. Again, this is a barbed suture, so I don't have to do knots. And you can see that is all, so everyone always worries that you're going to fall apart, and if there's a little hole in the skin, you're going to fall apart. You're not, because have a look at this. This is taking all of that tension. So if you have a look here, there's virtually the skin edge, it moves. I thought this would be easier with the drawing. You can see here, these skin edges are almost sitting together just from that deep stitch without putting anything into the skin. So if the skin opens up, by and large, there's no big drama because you've got a lot of deep stitches in there as well. All right, so that's pretty much the operation. We then close the skin and put the dressings on, and I just wanted to show you what that looks like. So that's the patient with the dressing on the belly button. You can see from the side. Now, this is what I wanted to show you. I can't pause it, I don't think. But if you remember, I showed you those lines. So that is that line there where those where the oblique muscle is coming into the rectus muscle. So you can really see it there. You can see a nice flat tummy. So what did you think of that? Too much, too gory, too much detail? You want more detail, more gore, more blood? Were you surprised how little blood there was? I think it's pretty amazing. And that's a little bit of that is modern surgery using cautery. You know, sort of before my time, surgeons actually used to grab that lower skin and basically tear it off that lower surface. I'm actually told some surgeons still do that, quite horrifyingly, but not me. So I try and have as little blood loss as possible. So I've got another operation. This one's a little bit harder to film and show for YouTube and Facebook because we're a few sensitive areas, but hopefully I can with these I can show you enough. So all right, so we're going into a breast reduction. So here I am, I'm marking that upper pole of the breast. I'm marking the line of where the nipple is going to be moved up to, and then I'm marking the level where I want the nipple to be. And if you can see that there, I've decided where the nipple is going to go, and you can see I've lined it up with the laser leveler again. I've made, so you can see here, I've made, I can draw on this beautifully now, hopefully. I've made a new opening for the areola. Oh, that's a bit weird. Okay, new opening for the areola. There's a cut down here and a cut down here. And those two then come together. And then a cut, which is then going to be the lower part of the breast. Now, you're going to see in a second, make the areola smaller, and that moves up into that new opening. And then this is the breast tissue that is going to be removed. All right. Okay. So obviously a little bit limited on what I can show because of the nipples and stuff. So there's not a lot I could show intraoperatively. Okay. All right. So one thing everyone wants to know is how do you make the circle for the areola? So probably explain to a lot of you. This is me just demonstrating what I've just showed you. Those two come together. So we've got a little cookie cutter. So that's got a sort of not a sharp edge, but a pointy edge. And I've got a marker on the cover over the areola. But I just showed you, I want to show you on this person's tummy. So we push that in to make an indentation, and you zoom in there and you can see that it's a bit dark, so I can't do much about that. It's made that little indentation around there, okay? And so all I do then with my assistant giving me a little bit of tension is I cut around that indentation to make a perfectly round circle. There are a couple of different sizes of areolas. I tend to use the smaller one, 38 millimeter diameter. I think they often stretch. I'm not sure it makes a huge amount of difference, but by and large, I think most women want to have as small an areola as possible. And that just works with all my markings. The circle fits into my new opening, so I'm comfortable with doing that. So that's how we mark out the areola. All right. Okay, the next bit, you do need a warning for this, but you made it through the tummy tuck. You'll be all right with this. This is me cutting off that lower pole, so that lower part of the breast. All right. So I've made that cut. So you saw that horizontal incision that I made earlier, and that's the main chunk of tissue, and that's got breast and fat tissue in it. That's the main chunk of tissue that we remove. And you can still see, my blue line there, hopefully. And you can see the other markings there as well. And everything below that blue line, pretty much, that's what I've cut away. So hopefully that explains that. Well, I couldn't show a boob explosion, Jess, sorry. All right, so then it was too hard to show everything coming together because I couldn't have a dressing covering the nipple and can't show a female nipple because the whole world will collapse. So we had to settle with just showing you this. So this is looking from the feet up. And this is a really important part of the operation. So you can see here, actually, let me do it in yellow. I think that'll make it easier. Sorry. Sorry. All right. It's going to have to do. Okay. So you can see here, there's one side here and one side here. And what I'm actually doing now is, so these are the sort of internal stitches, not the internal bra. We'll get to that. And I'm stitching these two together. So you might hear people talking about pillar sutures. And that's what that is. So the two sides, so you saw those two, those two lines that were like that, and I'm just bringing them together there, and that's what creates that nice shape. And you see from below, just overall, that's creating a nice breast mound. And that's not something that we used to do traditionally 15 years ago or so, but most people have heard me talk about it. All right, so this isn't too gory. You'll be okay with this. We've done warnings everywhere. So this is the internal bra. So you can see how mobile that is. You can see the feet are down towards the far end of the picture, and I'm just stitching that skin down onto the chest wall. Again, that's a reason why sometimes that might be a little bit sore, not in everyone, but sometimes is a little bit sore in the immediate post-op period. But I'll get to the end of this in a second. But I'm just stitching. There's a layer of thickened tissue, which is very, very strong. I'm stitching that in the skin and stitching it down onto the chest wall, again with one of these barbed sutures. And you see that is just locked in there, not going anywhere. It's not going to move, and gives you a nice, stable internal bra, exactly where the internal bra should be. All right, so that is all for the videos. Let us know if that was helpful. It was quite a bit of work, but if it helps people, then all worthwhile. All right, so let's get into your questions, hopefully. Here we go. All righty, so let me search by Q. Here we go. Why do you gut the tummy tuck section into two parts? It really just makes it easier to handle, and because I do it right in the midline, I can do a temporary test to make sure I'm not cutting out too much skin, because sometimes I'll make that upper mark, and I might be worried I've gone too high and I've got to go even below the belly button, or I think I can go a bit higher. So sometimes if I'm worried at that point, I'll bring those two ends together. We'll flex the bed, make sure I'm happy that I'm going to be able to close the skin before we cut the skin off. Obviously, once we've cut the skin off, it's a little bit too late. Does everyone so thanks for that question, Amy. Jasmine, does everyone need a muscle repair who has a tummy tuck? Virtually everyone. Certainly females. I can't think of a female patient where I haven't done it. Actually, I might just turn that off. Actually, let me just try something and see if that helps speed things up. So for females, very rare not to. It also does help create a little bit of shaping of the waist. So it's virtually mandatory for me in every patient. I tend not to do it in males because males don't want that curvy figure. Lily, great questions. Everyone, tummy tuck at liposuction. I reckon probably maybe 50%, mainly in a sort of shaping use. It's very much used in conjunction with a tummy tuck. It's virtually, if you're doing a tummy tuck, it's virtually never the main show. But I'll sometimes do a little bit on the waist, as you saw in this case, and sometimes a little bit centrally. If you watch some of our other videos, we go through in great detail why you just can't do liposuction everywhere. But yeah, sometimes a little bit for shaping. So thanks for that. Jane, how do you decide where to put your belly button? I can feel underneath that skin where it is on the tummy wall, and I feel through the skin, and I just mark it and put it there. Amy, can you create a brand new belly button? I actually did that this week. Patient who'd had some previous surgery and there wasn't much of a belly button, and I just felt it would look better with a new belly button. So there's techniques to do that. Sometimes if it's a really severe hernia, you're in a position where you've got to do that. So yeah, that is definitely a procedure. Jane, when do the drains come out? When they stop draining. Most people with a tummy tuck would go home only with one drain at most. The other one, I'd say a third. So I'd say a third go home with none, a third maybe a week, a third maybe 2 weeks, might still have a drain in. Very uncommon to be longer than that. Apologies to anyone who did have one in longer than that. Susan asks, do you do all the suturing or does the assistant do half? Not sure they do half. I do all the important suturing, and I only work with assistants who are very experienced. And if for whatever reason I'm not happy with what they're doing, I'll take out their sutures and redo it. But they're all very, very good at suturing. And the nurses also keep a pretty sharp eye on them, and if they're not happy with what's being done, they'll let me know and I intervene. So it's all certainly done to my standard. I do way more than half because I'm faster than most of them. But if they weren't there helping, you'd be on the operating table a lot longer. I've certainly never seen any difference in scar quality. There are some surgeons who don't do any of the suturing, but yeah, I'm not one of them. All right. Kayla wants to know, we just talked about drains. Leanne, if doing a tummy and breast reduction at the same time, which one do you start with? Good question. What do you think? Does anyone have a view which one I might do first? Have a think about it, because it should be obvious a little bit from that video. So it's the breast first. And the reason is, for the tummy tuck, I've got to bend that bed. And if I've got the bed bent and you're sitting up, it makes it much harder to do the breast reduction. So it is always the breast reduction first for that reason. How do you pick whose surgery I've got to film? Well, it's when I get told that I'm doing a Facebook Live on live surgery and I have to find someone who has a surgery coming up that it fits with what we're going to do. That's usually the thing. There are some patients who, when I'm marking them up, will ask if I can video things, and I usually video the muscle repair, not usually breast reduction or breast augmentation. But yeah, it's pretty random, and always grateful when people agree to have it done. Leanne wants to know how long does it take for a breast reduction? Depending on size a little bit, but between 2 and 3 hours would be an average. We've done the liposuction question. If you have muscle repair, where would the cuts be? Do you mean, Jasmine, I'm not sure if you mean if you're not having a tummy tuck. That'd be a pretty unusual scenario. But yeah, there are some people who have tried to do it keyhole, but not plastic surgeons, but you don't get anywhere near the same strength of repair. So yeah, you'd have to use the same incision. If you weren't cutting out skin, it'd make it much, much harder, but I suppose it'd be possible. I've never been in that situation. With a breast lift, if one breast is smaller, can you make that one the same as the other one? Absolutely. How long to stay in hospital for a tummy tuck? 1 or 2 nights. So I had a patient this week who just stayed 1 night, absolutely fine. That's not a problem. Otherwise, it's 2. I like patients getting out of hospital. You don't want to be in hospital if you don't have to be. Breast reductions. Do you manage the breast the same time? How do you manage? So the nipple the same height as pre-op. You saw me marking that with the laser. Matching them. So if you remember when I was doing the 2 parts coming together, and they were both even, so I can adjust them. So I try and make sure they're even. Also with the pedicle, so I'll often measure that and then match it to the other side. The other way is if I know one side is bigger than the other, I'll take more breast tissue out of the bigger side so that they're similar. No 2 breasts are identical. We can aim to get closer, but they're never going to be identical. I mean, like muscle repair tummy where, yeah, Jasmine, I think I've answered that. I think it's the tummy tuck incision. I can't think of a scenario where I'd be doing a muscle repair without a tummy tuck. When performing a breast reduction, breast lift, and a lower body lift, do you still do the breast? No. So then I do the back first, then the breast, then the tummy. And for logical reasons, if I did the breast first and then flip, then you're sitting on your new breasts, which I don't want you to. And so, yeah, that's the order there. All right. Okay, I think we better move on. So coming up next month, here we go. So for those of you who are avid listeners to our podcast, and all of you should be, Kim had a podcast all about her, which went live last week. So check that out. Next is a podcast about one of my patients, Gab, who terrific patient, and she had a little bit of a difficult post-op course, and she's going to go through all of that. And then Kim's going to be talking about tummy tucks on the 25th of January, so don't miss that one. For those of you who are big fans, I'm sure you know about the newsletter. You should be able to, that comes out every month. You can sign up through the website. If anyone doesn't know how to sign up, just drop us a note after this, and we'll be able to let you know. But you should be able to find that on the website. And then, wow, this is running super slow tonight. I'm not sure why. Someone maybe in their 20s who hasn't yet breastfed. And my discussion with them around that is, well, firstly, you don't know if you're going to have kids. Second, you don't know when you're going to have kids. All about breast reduction. So thirdly, it's not when you have your first kid, it's when you have your last kid. And then lastly, it's if you could breastfeed anyway. So you may not be giving anything up at all. You may never be able to breastfeed. You may never have kids. But is it worth waiting 10, 15, 20 years with neck pain, back pain, not fitting into bras, not being able to do sport? Is it worth waiting on the off chance you might be able to breastfeed? All right. So that is all I've got for you tonight. That was a massive group that we had following. So we may have to revisit this live surgery thing. So if you did like it, and you want to see more of that, just drop us a line in the comments, and we'll try and get some more footage. I was going to end with some holiday snaps, but I obviously forgot. So I'll be back in a month. Thank you all for watching. I hope that was helpful. I'll see you next Facebook Live.